Well, welcome everybody and congratulations to all the graduates. Years from now, you'll have the best graduation stories, I think, of anybody. You'll have the most unique memories about this year. I do hope that you're celebrating and that you're proud of yourself and that you're excited about starting your first semester, whatever that's going to look like. I know some of you are going to be going to school in person. Some will be doing a combination of virtual classes online and going to some classes in person. But I hope you'll keep in mind that whatever this year looks like, it's not going to be that for all of your undergraduate years. And I hope that you'll have friendships that get started even this semester that are going to be with you for the rest of your lives. So I get to cover some of the other medical topics that we're today, talking a little bit about planning medical care, and Whitney's already introduced that. So we'll cover some of that. I'll talk a little bit about immunizations, mostly immunizations that everyone should have going off to college, and one in particular that's helpful for people that have type 1 diabetes. We have to talk about COVID-19 because it's the elephant in the room. And I wanted to, give you some information that hopefully will help you with some of your decision making. And then when COVID's over, I hope that you'll be thinking about doing a month or a semester abroad. And I wanted to give you information about that. I'm really happy that John Beckman is one of your panelists tonight because John can give you great information about traveling. I was very proud of the fact that by the time he finished his college career, he had done a lot more traveling than his endocrinologist had ever done. So you'll get to hear from him a little bit later. First of all, to kind of follow up on what Whitney was saying, work on going ahead now and scheduling your visits on breaks. Since we're letting people schedule up to a year in advance, you can schedule your winter break and your summer break if you'd like. The recommendations for somebody that's your age, or someone who's 18 or about to be 18, through the rest of adulthood, is that you check your hemoglobin A1C 2 or 3 times per year. So for somebody that's in good control, if you're not feeling like it would be helpful to see us to discuss anything from a technology standpoint or an emotional and mental health standpoint, you can really get by with 2 diabetes clinic visits a year. If on the other hand, you're having trouble kind of getting your A1C back in a range that you'd like, I'd really encourage you to think about coming and seeing us on fall break or spring break, or, for many of you to do that by video, since we've got that available now. Each of the endocrinologists and the diabetes nurse practitioners is going to have certain days that they're in video and certain days that they are in person. The other thing is that when you're coming for those two or 3 visits a year, one of them should include your annual labs, including a urine microalbumin to make sure kidney function looks good. One of them should include a foot exam, and it would be good to schedule an eye exam. The timing on the eye exam is changing a little bit. The American Diabetes Association recognizes that with pumps and continuous glucose monitors, and even with taking multiple injections a day, the majority of young people who are starting college don't have any type of complication from diabetes. So the eye exams may actually be changed every 2 years, but it'd be good to get one. If you can't get it in now, try and get it in next summer, and then from there look to see if the recommendation is once a year or every 2 years from there. One of the other scheduling numbers, I think the one that Whitney gave you is better because it's a 1-800 number, but the local number is 263-6420. And if you call that number tomorrow and ask for extension 3, they can set all your diabetes appointments up for the rest of the year. I would second what Whitney said about MyChart. It is so incredibly helpful when you're in college or grad school because you don't have to wait for somebody to call you back in between classes or, possibly get a phone call when you're in class. The MyChart sign up has gotten much simpler now because of COVID. It's one of the good things that's come out of us doing so many things virtually. The one thing to keep in mind is that it's not something you'd want to use for an emergency. So if you've got vomiting and ketones, call our clinic number, tell the receptionist it's an emergency. And that would be ketones, vomiting, having a seizure, having a pump that's failed, something along those lines. That's, those sorts of things, somebody should give you a call back quickly. As far as, some other topics we want to talk about, when we see you in clinic, we want to know what's going on with your life. We really enjoy the summer and winter visits. Hearing from the students and, kind of brainstorming with them if they're having trouble fitting in diabetes management into their semester, celebrating with them if, some things have actually gotten easier, talking about semesters that they want to do abroad. That really a lot of planning going into that makes it go very smoothly. And ask us what's new. The rate at which technology is changing, it seems to be going faster and faster over the last few years. And that means that by the time you graduate from college with your bachelor's degree, there are probably going to be several new improvements on what we can offer you in the summer of 2020. Do check in with us and make sure that we've got your labs ordered if you're due for labs. Not only will your on-campus options for counseling be much more than what you had when you were in high school, but we can also help you try to set something up through your insurance, either at home virtually or in whatever city you're going to end up in. And you've got all these changes coming up. You're in the middle of COVID, and then on top of being in the middle of COVID, it's going to be your first semester away or not. Maybe some of you are going to be staying at home. But counseling can really help go a long way to make the whole college experience much more enjoyable and less anxiety provoking, and also to make your day-to-day life a lot more enjoyable. Does anybody have any questions about any of that? Is everybody able to see the slides right now? I got one message that said people couldn't see slides. Are you able to see them now? Or
yep. Yep, we can see the slides. I think your video is not on. So if you want to share that, feel free to. Otherwise, I think we're good.
All right, I'll try and work on that. So the next thing to talk about is immunizations. And let's see if I can get this to, I don't know. Okay, I'm just going to pop out for just a minute so that I can pull up the video. I don't mean to be doing this anonymously. So talking about immunizations, the first one to think about is the influenza vaccine. And from being in clinic all these years that we always bring that up. The important thing to know is that it's going to be available in September. And while we're also dealing with COVID, it might be nice to have the opportunity to get your influenza vaccine early so that it'll start to take effect early. If you've read the list of symptoms that go along with COVID-19, a lot of them sound like symptoms that accompany influenza. And so it's a lot of the campuses are going to offer the influenza vaccine on campus. Some of them actually included, I think University of Minnesota has done so much research on immunizing college students that they sometimes offer it for free. But lots of the colleges will offer it or offer it at a discounted rate. You can get it at a clinic visit. You can get it from Walgreens or CVS or Walmart, one of those pharmacies. The important thing is to go ahead and try and get it early. We know that some people that had COVID got it when they had influenza. So we'd like to try and really make sure that we're leaving as few opportunities for you to have ketones as possible. It will be available mid-September, and it's going to have the strains of influenza that we're seeing in Asia in the summer, because that tends to be what we see in the wintertime. It's going to take about a month for the protection to really build up once you've had it. So think about that it's going to take a little time to act entirely. The other thing is that if there is an inhaled version, that's not recommended for people with diabetes, because the inhaled version, the nasal one, has live influenza virus in it, and that would promote ketones. So that's why we recommend the injection instead. Another vaccine that's recommended for anybody who's going off to college, it's now recommended for all teens usually, usually by the time they start high school, is the meningococcal vaccine. That protects against one type of meningitis that's called meningococcal meningitis. And it also protects against an overwhelming bacterial infection that's called meningococcemia. Both of those are really severe. They have been seen more in large groups of people, so tended to be when someone was living in a dormitory or at a military base or things like that. The Centers for Disease Control now recommends it for everybody. Most of you have probably already had that vaccine. And you can check with your primary care provider to be sure about that. There's an additional meningococcal vaccine that is for strain B, which is not the one that's most common, but there was an outbreak of it at University of Wisconsin just 2 or 3 years ago. And so when that was happening, that vaccine was recommended for students who were on that campus or going to be around that campus. So that's one that you might also look into if there's an outbreak at your school. You can get it ahead of time, or you can get that if it's seen in a place where you're living. The next vaccine is one that's a little bit more specific. Pneumococcal, the pneumococcal vaccine is against a bacteria called Streptococcal pneumoniae, and it causes pneumonia, sinus infection. It can cause ear infections, but it can cause an overwhelming bacterial infection, which we call sepsis. It's just when the bacteria is actually in the bloodstream. And it's more common in certain groups of people. And one of the groups of people is people with diabetes. So it's recommended that everyone who's got type 1 diabetes get the Pneumovax. That's the specific form of the pneumococcal vaccine that's recommended for someone who has type 1 diabetes. Many people have had the other form. The Pneumovax is just a little bit more extensive. So it's worth asking your primary care provider if that's the one that you've already received, or if you need to get the Pneumovax before you head off to school. So that's a good thing to keep in mind. We'll switch gears just a little bit to talk about COVID-19. You've probably been inundated with all the descriptions of what the symptoms are and how some people have really severe disease and some people don't have severe disease. The studies that have come out as recently as this week suggest that people who've got well-controlled type 1 diabetes don't have an increased risk of catching COVID, and you don't have an increased risk for the lung complications. If someone's uncontrolled, or especially if they have type 2 diabetes, then they are at more risk. The thing that's been seen so far in the patients around the world who have developed COVID-19, who had type 1 diabetes, is that they have a high likelihood of developing ketones while they've got COVID-19. And some of them can go on to ketoacidosis. So that's why we're really stressing knowing what your sick day plan is. Basically that that if you don't feel well or you think you might have COVID, even if your blood sugars are perfect, keep checking them. And every 3 hours, give yourself your corrective factor, your correction factor, and keep checking urine for ketones. If the ketones are trace or small, drinking fluids and keeping up with your insulin should help that go away. If they're moderate or large, you may need more insulin. So if you start doing the correction factor and you're not seeing your blood sugars improving or the ketones going away, give us a call because we'll talk about a more specific sick day plan. COVID-19 looks a lot like influenza when it comes to ketones. So we see people every year who have ketoacidosis when they have influenza, and it looks like the same thing is true, or perhaps a little bit more true, if you get COVID-19. That being said, we've had kids who've had it and have not had ketones at all. We've had some who've had COVID-19 and had to be in the hospital for a day or two, not because of the COVID-19 problems, but really just because we needed to get rid of their ketones and get them out of DKA. So it's definitely something, to really pay attention to, but also to know that when the original studies were coming out and talking about increased risk with diabetes, they were talking about type 2 and uncontrolled type 1 with complications. So you can feel better about going to school if you're doing the things that all the rest of us are doing, if you're wearing masks everywhere, and if you're using hand sanitizer and washing with soap and water, that you're not at an increased risk compared to your roommate. Again, if you get COVID-19, talk to your family about it, talk to us about it. Let's have a plan where you're checking your blood glucose and checking ketones, giving insulin every 3 hours. And again, if you start using your sick day plan and the ketones are not decreasing or they're not going away, or they're going up, then give us a call. To have a couple of these websites, because there's so much out there. There's a lot of nonsense that is out in social media about COVID-19, and some of the websites are, it's kind of hard to sort out what's good and what's not valid. So the CDC has a very good section on COVID-19 on their website right now. That's where the most up-to-date information is placed. And I checked over the weekend, and they actually had the update about type 1 diabetes as compared to type 2. Another one that I guess we're kind of fond of is our uwhealthkids.org website, uwhealthkids.org /type 1 diabetes. There are a lot of things in there about technology and about apps for your phone, but there's also a really good section on diabetes sick day knowledge and what you need to be doing. Cassie gave you some really great information about things to keep in your dorm room in case you do have a sick day, and Whitney's gone over that information with you. I'd say go out and buy that stuff and put that in a box to take with you to school. Put it in a container, label it sick day, so that you've got it if you need it. Another thing that can be helpful, this is as a parent of 2 kids who've been through college, is that we found it was helpful for them to have a gift card that was specific to the pharmacy that they were going to be using at college. One of them got pneumonia and needed to go get antibiotic, and that they had their money for their antibiotic. So you might think about something like that. And if you want to have your prescriptions both at home and at school, you can do that. Please let us know far in advance if you need a paper copy of things to take with you. But if you're using something like CVS or Walgreens or Walmart, they're able to kind of transfer your prescription back and forth from one city to another. So that can make it really easy. So that's worth thinking about. Does anybody have any questions about COVID-19 before we go on? I can't see the chat, Whitney, so if you'll let me know.
Yep, I don't see anything yet. And I did try to change permissions, so you may now have the choice to unmute if you didn't previously. Okay. I think we could keep going, and then if we see anything in the chat, we can catch it at the end.
All right. I wanted to talk a little bit about stomach flu because, well, 2 things. One is that a lot of times people will be really disappointed. They get the influenza vaccine, and then, later that winter, 2-3 months later, they've got stomach flu. Stomach flu is what we call gastroenteritis, and gastroenteritis is not prevented by the influenza vaccine. So it's a completely different virus from it. The other thing I wanted you to know is that ketones and ketoacidosis can look like stomach flu. And a lot of times when we're on call on the weekends, whether, Dr. Lowell or Dr. Zevin or I, or, whoever's taking the calls, somebody will call and say they have stomach flu. What they really have is ketones and vomiting. You get nausea with it. You got abdominal pain. You can, throw up a lot with it. Stomach flu is different. Stomach flu has ketones and vomiting, but it also has fever and diarrhea with it. So if you wake up and you're throwing up and you've got ketones, it may be that you've got some other illness getting started. It might be that your pump isn't working. That's always the first thing to think of, is that the pump malfunctioning is number 1. Or it might be that you fell asleep and you were studying and you fell asleep and forgot to take Lantus, and so you didn't have any long-acting insulin overnight. So think about, sort it out a little bit. Do you have fever? Do you have diarrhea? If you don't, then it's probably more like the pump not working or the Lantus being missed. Ketones and vomiting are in both of those illnesses. Any questions about that? Okay, then I'll move on to something that's, well, one more thing, and then we'll talk about something that's kind of fun. Occasionally you might get sick and have a normal blood glucose. I know that most of the time when you're sick, your blood sugar is going to be high from all the stress hormones that are part of the illness. But occasionally someone will have a normal blood glucose or even a low one. But if you've got ketones, no matter what your blood glucose is, it means you need more insulin. And so you've got to check urine ketones. If you are sick, if you feel nauseated or you have fever, or you've got a bad cough, you need to check your ketones even if the blood sugar is perfect. I remember we started this class about 20 years ago at the recommendation of a college student who developed ketoacidosis. He had a stomach flu and his blood sugars were going low instead of high, so he turned off his insulin pump and called his mother, which is always the right thing to do. And she recognized what was going on and sent him into the ER. So if you've got an illness, even if the blood sugar is perfect, you could still have ketones. So check the ketones. If your blood sugar is low or normal, we'll try to see if you can drink things like Gatorade, like a tablespoon of Gatorade every 30 minutes or so, to get your blood sugar up enough so that we can give you some more insulin to clear out the ketones. If you can't do that, then what we do is have you go into the ER and get some IV fluid for a couple of hours, and then hopefully you could go home after that. So when in doubt, if you think you're sick, check your ketones no matter what the blood sugar is. Now, some fun part. I hope that when we see you next summer, that some of you will be planning for a semester abroad. For some of you, it might actually be that you're going to actually get to be in the dorm finally after, maybe being home for a semester or two. But if you're thinking about a semester abroad, get us involved as early as possible. Our nursing staff and our physicians have helped lots of people do this. And we've also gained good information from people like John Beckman who have brought back additional tips that we didn't know when they've done it. It's really something that it expands your world, and it is a wonderful opportunity to also see, how things are done at other universities in other parts of the world. The other thing is it's going to be cheaper for you to do that as a college student than it will ever be for you to travel anywhere again. So that's certainly worth thinking about. A couple of things to do. One is to notify the diabetes team so we can give you some ideas about how to transport your insulin. Another one is to look on the CDC website and see if you need any immunizations to go to the particular country you're going to. Right now, we really don't usually need anything to go to Europe, but that may change, if there's a vaccine for COVID. If you're using an insulin pump, look into renting a spare one for the semester that you're away. The pump companies will usually do that. They charge a small fee, but not nearly what you'd think they might charge. Last time I checked, it was about $50. The other thing is to talk with your pharmacy and your insurance company, because they all have contingency plans for dispensing more than a month of supplies at a time if someone's going to be traveling out of the country. If you're going to be gone for 6 months, maybe you want to have your parents come visit you in Spain so that they can bring some supplies for the last 3 months. If you're going to be there for a year, you should really work on figuring out how you're going to get things. We don't usually recommend getting the bulk of your supplies from Europe or from any other part of the world, because they have other strengths of insulin besides the U100 used in the United States. And some of the markings and some of the other supplies that you're accustomed to may not be available. So you just want to take those things with you. There's also a travel guide that's put out by the American Diabetes Association. There have been at least 2 editions of it. There are a lot of other good materials now available on the internet to talk about things that make it easier to travel, and finding cool packs that will keep your insulin at the desired temperature for 48 hours. It's good to know where the U.S. consulate is in whatever country that you'll be traveling in case you had something weird happen. We once had somebody who needed to have surgery, and so it was good to to have some contacts going back and forth between Australia and the United States when that was going on. Check your phone plan, particularly if you're on your parents' phone plan. Make sure that it's going to be economical and possible for you to be texting them or to be calling them while you're there. And if you do find that you're going to need any vaccinations, most HMOs authorize visits with an international travel clinic. I know of at least 2 of them in Madison. So that's something you might want to look into if you do need vaccines, having looked at the CDC website to see what vaccines you need. So I'm glad to take any questions. I hope your first semester is wonderful. It's going to be unique. Nobody else will have a story like yours to tell. and we'll look forward to seeing you guys, whether in video visits or in person, when you're home on winter break. So congratulations, and on with the panel, I think. Whitney may have.
Yeah. Yeah, just one question, Ellen, that's come up so far was someone asked, so based on what you said, do you consider it reasonable for kids to live in the dorms?
Yes. Yes. I would say it's reasonable to live in the dorm as long as they have good hygiene. The dormitories are all going to have procedures to decrease how close the contact is. The universities that are allowing in-person stays have worked out procedures where if a student did develop COVID, that they would actually be in a different location. So you wouldn't have, for example, your roommate coming back with COVID and you having to live with them while they're recovering from that. I think that right now we know that if you're in good control, that you're not at an increased risk of getting it. And if you're using the same good hand hygiene and really paying attention to the masking, and observing the physical distancing, that's reasonable. So yeah, I wouldn't say that everybody needs to stay home this semester. I also, for those of you who are going on campus, be prepared that it's possible that your school may need to change. If they have a certain number of students who are infected, they might need to send more, to change the semester to being more online, or change some of your classes to being more online. So, it's also important to realize that you may get there and be there for a few months and then they, end in November instead of December or something like that. Any other questions?
Yeah, any other questions?
I'm glad somebody asked that. I was going to mention that, but I forgot.
All right, so
okay, myself.
I'm just going to stop recording now because we're not going to share this portion of the presentation.